Hello, my name is Dr. Sally Payne. I'm an occupational therapist and trustee of the Dyspraxia Foundation, and I'm going to spend the next few minutes talking to you about the findings of a recent Dyspraxia Foundation survey which explored the experience of physical activity among dyspraxic people. We chose this topic because we know that physical activity is important for people's physical and mental health, but the research is showing us that dyspraxic children have much lower rates of physical activity and are much less likely to take part in organised sports than their peers. Alongside that, the research reflects what we know from our experience that dyspraxic adults tend to avoid taking part in team games and sports. The implications of all of that is that physical inactivity has an effect on people's fitness, weight, their health and well-being, and dyspraxic people of all ages. So to our survey, we carried out an online survey during the month of August into September, and it was aimed at dyspraxic people, adults and parents and carers of dyspraxic children. We had almost 850 respondents, with 803 providing useful data. Most of the respondents, the adult respondents, were female, which is not surprising because women tend to be better at filling in online surveys. But we see that the parents who responded to the survey were more likely to be the parents of a boy than a girl. And again, that reflects the population of children that we see coming through the clinical settings. I think it possibly also reflects the fact that girls and women are perhaps more likely to be diagnosed as adults than boys, a subject that we've explored in previous Dyspraxia Week surveys. So what were our key findings? Well, 88% of those who responded to the survey said that dyspraxia affected their participation in physical activity. And in fact, the recommended amount of physical activity per week, which is 150 minutes or more, is only achieved by 32% of dyspraxic children. That's compared to 45% of children in the general population, and 29% of dyspraxic adults, which is compared to 61% in the general population. So that's a significant number of dyspraxic adults who are not achieving the recommended physical activity. This is of concern because we know that physical inactivity increases the risk of weight gain, heart disease, diabetes, anxiety and depression. We really need to understand the factors that are affecting physical activity participation among dyspraxic people so that we can address them and encourage people to be more active. So what did our findings, what did our survey say? 73% of dyspraxic adults said that negative experience of PE and sports at school had long-lasting impact on their confidence to take part in physical activity. 58% of adults were worried about being embarrassed by their motor incoordination, while 40% were worried that they might hurt themselves. One person said, "I was made fun of for the way I run or how clumsy I am. PE lessons as a child were hideous." And another said, "In PE and in sports clubs as a child, I always progressed a lot slower than others, which can be very difficult emotionally, even when people aren't judging you. It's much worse when they are." This slide highlights more factors that make it difficult for dyspraxic people to take part in physical activity. Many of the key features of dyspraxia were identified here, such as difficulty learning and keeping up with movements, following instructions and fatigue. The impact of fatigue or tiredness isn't surprising, as because of the extra physical and cognitive effort required for dyspraxic people to carry out the activities that many of the rest of us take for granted. Findings showed that males under the age of 18 were much more likely to be put off by the competitiveness of other people, while females are more likely to be concerned about the risk of injury than males. Boys under 18 are least likely to be bothered about the risk of injury, which perhaps reflects the general population. Fatigue is more likely to be identified as a barrier in children than in adults, and unsurprisingly, adults were more likely to be put off by those previous negative experiences that I mentioned in the previous slide. I think what our survey shows is that a lack of understanding and awareness of dyspraxia amongst others, especially from those who perhaps should know better, can have a really long-lasting impact on people's confidence to take part in physical activity. And this is something that we are addressing throughout Dyspraxia Week 2022 with the launch of our new resources for instructors and our programme of webinars, which I'll mention more about in a moment. So what have we learned about the activities that dyspraxic people already take part in? Well, swimming was the most popular activity for people of all ages, but other popular activities were those that don't involve working as a team, and many of the activities on this slide here can be carried out as individuals or in small groups. This information is really helpful for us as the Dyspraxia Foundation and for you as people watching this presentation, because maybe we want to steer people towards the activities that dyspraxic people have told us they enjoy and participate in. We also asked about the activities that people would like to do. Low impact activities were the most popular, so swimming, dancing, archery and so on, and unsurprisingly there was less enthusiasm for team sports and those requiring a partner. People identified more barriers to participation for activities that require a higher degree of strength and resistance, reminding us that these are key difficulties for dyspraxic people. But we also learned that more people are interested in perhaps taking part in higher impact activities than are currently taking part. So we've got an opportunity here to increase dyspraxic people's activity levels if we can address some of these barriers to participation, which will be good for their longer term health and well-being. To achieve this, we need to raise awareness of the adjustments that will help instructors and dyspraxic people take part in those activities. We also recognise, of course, that cost can be a barrier to participation in some activities because they require a particular uniform or equipment. So we're especially keen to share information about low-cost activities such as running and walking that may be more accessible for more dyspraxic people. We were also interested to find out whether dyspraxic people's participation in physical activity had been affected by the pandemic, and many people said that it had. 52% said they did less physical activity during the pandemic, while 27% said that they were actually doing more. Many of the latter groups said that they'd more time to include physical activity into their daily routine when they were working from home, and some had discovered online yoga and other classes which they could do at their own pace and without the risk of others noticing their lack of coordination, which was a positive thing. So how did changes in physical activity levels during the pandemic affect dyspraxic people's physical and mental health? Well, 78% said that it had changes had an impact, with 29% reporting an improvement and 48% reporting a deterioration. Unsurprisingly, those who stopped or did less physical activity said their mental health had declined, whereas those who did more noticed improvements in their physical and mental health. So we need to find ways to reduce some of the barriers to participation so more dyspraxic people can experience the physical and mental health benefits of physical activity. So what can we do? The top recommendation identified dyspraxic people is for greater awareness, understanding and adaptations to enable participation in schools, gyms and amongst the general public. But dyspraxic people also need support, and it's important that we increase self-awareness amongst dyspraxic people so they know what adjustments to make or ask for to increase their confidence to be more physically active. 117 people said dyspraxia-friendly sessions would be helpful. For example, sessions specifically for people with dyspraxia, or smaller groups and instructors with specific dyspraxia training. People asked for more one-to-one support, even in group activities, with a better pacing and simpler instructions to help them take part to the best of their ability. Several comments from parents also indicated that not having to change for PE at school, for example wearing the PE kit instead of a school uniform on PE days, had benefited their children during the pandemic, and they felt that that would be a helpful adjustment to reduce some of the stress of taking part at school. And finally, what are we doing at the Dyspraxia Foundation to make sure dyspraxic people have the opportunity and confidence to benefit from increased physical activity? Well, during this Dyspraxia week, we'll be launching a series of refreshed information sheets for activity instructors, focusing on swimming, martial arts and horse riding. And we're publishing some new top tips for running, which have been crowdsourced for members of the dyspraxic community. We'll be holding a series of sessions, webinars and activities to encourage people to be physically active, and publishing a number of blogs and case studies highlighting the support and activity successes of dyspraxic people to inspire and motivate others to take part too. So what can you do to help? We want you to share the information sheets with your activity instructors and to signpost people to our website for further information and advice. We've got some information for PE teachers, for example. If you're dyspraxic yourself, we want you to consider what steps you can take to increase your physical activity, perhaps being inspired by our webinars, the case studies and blogs. You can take part in our Dyspraxic Active campaign. Raising funds would be marvellous, but more importantly to celebrate the physical activity successes by sharing your photos on social media. And finally, if you are an activity instructor or have a particular passion for a sport or physical activity, then get in touch and help us to develop further advice focused on the activities that are important and enjoyed by you.